All right, well, good morning, everybody. And I get the honor of welcoming you to this year's Central and Southern Ohio HIMSS Conference. This is our fall conference, and this is a virtual conference, like many of what everybody's getting used to in this pandemic. So I appreciate everybody getting a chance to join us this morning. As a reminder, this is a two-part session. And so there is the sessions for today as well as next Friday, and hope you're able to join us for both. We've got a great lineup of presenters. And so really looking forward to the agenda today and listening to some of our industry leaders talk about some of the changes that are going on in our industry, particularly right now. So I first want to start, before I jump over to PowerPoint mode, and introduce some folks with our board. But before I do, wanted to mention that the Central and Southern Ohio HIMSS group is a membership group, and we continue to keep growing. We are at almost 1,500 members throughout not just Central and Southern Ohio, but our chapter seems to keep growing and increasing for those outside of our region. So it's fantastic to see that. It's also interesting to share with everybody here. I heard a statistic earlier this week that our followers, so between LinkedIn and a couple of our others, as well as Constant Contact, is somewhere over 5,000 members. So our interested parties. So thank you guys very much. So we're going to kick this off, and I'm going to switch over to PowerPoint mode. First, I wanted to introduce myself. I am Alex Vaillancourt. I am this year's president of the Central and Southern Ohio chapter. We are one of the chapters of National HIMSS representing Central and Southern Ohio. We keep active tabs with all the other chapters across the country and try to learn from each other to bring you, our members, programming and services that are relevant to what we need throughout our region. So my day job is also as the Chief Information Officer with the Health Collaborative here in Cincinnati. And we are a healthcare consulting and programs and services organization. So with that, I'm going to switch over to PowerPoint mode and do a few introductions. So again, just want to welcome everybody to joining us this morning. Got a great lineup for today and for next week as well. So with that, what I wanted to try to do is some quick introductions so that the folks who are joining the session this morning, we've got a volunteer board, and I have the privilege of working with this group of folks that you see on the screen here. Each one of our board chair roles involves a function where we try to make sure, again, that the programming that we offer to our region is appropriate. And so, for example, you hear more about our scholarships programs next week from Donna. Donna Carter is our marketing chair, doing lots of work to help make sure that the new branding that you see on some of the slides and some of that matches what happens with HIMSS. Our treasurer, Victor, Secretary Russ, Megan, who's joined us this morning, is our membership chair, tracking that. And I'm gonna forget everybody else. Andrew Nixon, who is our HIE liaison, helping us with hosting today's Zoom session. Neha Mata as our advocacy chair, Mark Lemperly as our sponsorship chair. And then I have to thank Scott Mash, who has been our president-elect, who will take over after me and keep going. And many of these folks have been part of CSOHIMSS for several years, which is a fantastic opportunity to see some continuity and continuing to see our programs and services continuing to grow and expand. With that, I also want to do a quick introduction to Rob Stillman, who is our program chair, who's taken the lead on helping us organize today's session as well as next week's session. So you'll hear more from him in just a minute. Hang on just a second. So before I hand this over to Rob, I also wanted to mention, I heard earlier this week a term on the media that the most used slogan of 2020 is "You're on mute," and I thought that was interesting because yes, we all hear that a lot. We're all adjusted to a new world of Zooms and WebExes and GoToMeetings and Teams and all the other virtual conference capabilities that we all have. But I think, you know, as the board contemplated the theme for the sessions for today and next week, I often hear the term surreal times, and it's very appropriate. We're going to look at 2020 years from now. I don't know that we'll look at them fondly, but will certainly be a memorable year. We've had the Australian continent has been on fire. We have had murder hornets, even an outbreak of the bubonic plague. We have had hurricanes through the Gulf that we've now all the way down to Z. Of course, coronavirus that we're all dealing with for the last 7 and 8 months, and some even longer. And then last but not least, it's an election year. So it'll be a year that I think we'll all look back and try to analyze and figure out what do we learn from this year. And so that's the theme of our conference. Hope you enjoy the sessions that we've brought to you. Always looking to you, our members, to help us with the programming that you think is most appropriate. And so with that, I'm going to turn this over to Rob.
Good morning. Oops, let me make sure can you hear me okay?
We
Good.
Sure can.
Muted? All right. I'm not on mute. Good morning, everyone. My name is Rob Stillman, and I am new to the CSOHIMSS board this year as the program chair. And before I get started, I wanted to really make sure I thank everyone who has been past members of the board and current members for helping me through this, in particular, Ajay Sharma, who was past president, who has had to help guide me along the way, and I think pushed all of us to make sure that we have gotten this program together. So it is very challenging, I think you all know, to be able, this is actually, I imagine, an easier process if we were doing it in person. Unfortunately, we can't. This would be, I think, the time of year we'd probably be in Cincinnati for this particular event, but we're all here virtually, which we've all become accustomed to. And I think we have a really great program laid out for everyone. And we have a really great mix of clinical presentations and IT presentations that, as Alex mentioned, are all focused on if we were to be down the road 5, 10, 15 years ago, that we could look back at this and go, that's what we were doing. So lots of conversation about what we were doing pre-COVID, what we're doing now, and kind of still the thick of it, unfortunately, and what does the future look like? So we've got, and obviously, and for obvious reasons, much of what we're focusing on, at least from the clinical perspective, are on telehealth and how we manage to continue to take care of patients. And as a healthcare IT organization, that's really our bottom line, is the patients are the center of what we do. So I think we've got a lot of great presentations that will address that. I do want to make sure that everyone knows that these sessions will be recorded and available after the conference is completed. So Scott Mash is going to make sure he compiles everything, gets them all edited appropriately, and get them out on the CSOHIMSS YouTube channel so that they'll be available for viewing later. Share with your friends. Also, as Alex mentioned, this is a 2-day conference, so we have morning sessions here that will run till about 1 o'clock today. And then please don't forget to come back next Friday, because we've got a lot of great speakers coming back then as well at the same time. So we'll open up again around this time, 8:30. Just make sure we're we're up and running and everybody's off mute and videos are working, and jump right into another selection of great presentations. So the agenda is out there on the screen before you. We have really tried to make sure that we bombarded everyone with making sure that they knew how to get into our sessions. So this is, you should have gotten probably more than one email that has the Zoom links for our session. So the first part of our conference running through, I believe, 11 o'clock. You can see on here. So our opening keynote from Kathy Kuhn, which will be starting here in about 14 minutes, we will remain on this Zoom session. Our breakout sessions each have individual Zooms. We were challenged to figure out how to best make this work and make it easy. So this is what you get. This Zoom session will be open for the entirety of the morning and will be moderated, so that if you are having trouble with any one of the breakout sessions getting into those Zooms, we can try to help you out there. But please refer to your email or the CSOHIMSS website to be able to get into the individual sessions there. So again, my thanks to everyone who is participating. I know I've got a lot of colleagues from OSU that I encouraged to get on, and I'm glad to see many of them on, and I know all of us across the state are excited about the presentations that we have today. And so with that, I'm going to turn this over to Mark Limperly, who's our sponsorship chair, to thank our sponsors. And just, oops, go ahead, I'm sorry. Just very quickly for the main Zoom, I think most folks are comfortable with how these works, but if you have questions, please put them in the Q&A. We'll try to address those in the breakout sessions. All of those sessions will also be moderated by a board member. So we'll do our best to make sure that we address questions that are coming through Q&A. And again, we will ensure that these sessions are recorded. Just as a reminder, this is a webinar function that we're currently in Zoom, so nobody is on video, but our breakout sessions may not be. So if you choose to be on video, great. If you do not, you may just keep that in mind, that that's the meeting version of Zoom that we'll be working with there. So just a reminder. So and any questions, let us know, and I will turn it over to Mark.
Great, thank you, Rob. So, I mean, really, so first introduction, my name is Mark Limperly. As Alex said earlier, I am the sponsor chair. Just from a general background perspective, I mean, currently at Cisco Systems, but prior to that, I have probably around 11 years of healthcare experience working at, EMR organizations, lab order results, and also acute care hospitals. So just a little background on me. As far as the reality is that, obviously we're a nonprofit organization, so we are really here to, again, provide content, things like that for you guys. And we simply can't do that without our sponsors. So having said that, if you want to go ahead and proceed, Alex. So we have obviously multiple tiers, but from a platinum sponsorship perspective, we have three partners: Fortinet, UpDocs, and Cisco. And definitely thank you very much for that platinum sponsorship level. And then for our premier sponsors, CoverMyMeds, VirtuStream, and Nordic, thank you very much. And for our lead sponsor, Trinisys. So yeah, again, thank you all very much for that. I mean, we can't seem to function or continue to function, obviously, without our help with our sponsors. So if there's anyone out there that has interest in sponsorship, I would be your point of contact, and don't hesitate to reach out to me. But other than that, enjoy the conference for both this Friday and next Friday, and look forward to seeing you guys someday soon in the near future.
All right, thank you, Rob, and thank you, Mark. So, want to welcome everybody again. We're going to get ready to kick off our keynote speaker here for the 9 o'clock hour. And before we do, again, just want to remind everybody, please, the virtual conferences, we're all getting used to those over the last, 8 months or so. I would encourage, questions, so feel free to chat or put those in the Q&A to our speakers, and our moderators are going to try to watch for those and then tee those up at the end of each session so that we can make it as interactive as possible. Rob said it well. We've all been to real conferences, and in fact, the HIMSS National Conference back earlier in the spring, many of us were scheduled and planning to attend. And it's a great opportunity to network. It's a great opportunity to learn from each other. It's a great opportunity to meet our presenters and ask them questions, about what's relevant to your business. So I would encourage making this as interactive as possible. Last thing I'll say, again, back to our sponsors. I certainly, this programming couldn't be possible without their support. And I would encourage you to take a minute. We're going to try to put their web links in the chat, but go visit our sponsors, understand what they do and what they bring to healthcare. It's often interesting to me, and until I became the president this year, I didn't realize how much the programming that we offer impacts the sponsors, and they want to know what programs and services do you offer. So they want to make sure it matches their business as well, right? And so they want to know who are the members, who's going to be attending, what organizations might be represented here today. So for our attendees, I would encourage you, go visit their website, learn about our sponsors, what they do and what they bring to healthcare. As we're getting ready to kick this off, title of our presentation is Time Capsule 2020. And as Rob mentioned, we're all going to look back and try to have lessons learned from this that I hope we can all turn into how do we continue to transform healthcare to be better and more effective for our patients and our communities. So if you guys will give us just a minute, we will bring our guest presenter up to the stage virtually, and then we'll turn that over to the next session.